Hey everyone, I'm Lauren Fleming with Him Supportwear, and today we have Meghan and Leah with Revolution Wellness to join us for our discussion. So thank you both for being here. We're excited to talk with you.
Thanks for having us, Lauren.
Thank you.
Can you tell a little bit more about your background and what inspired you to be in your current roles?
Yeah, I started, well, I've been a PT for almost 20 years. And if you'd asked me when I was in PT school if I was going to be doing women's health, I would have given you a hard no, because I wanted to work with professional athletes and sports and all that kind of stuff, which I did, and that was great. But then I started working with a lot of runners, and then a lot of my runners got pregnant. And when I went to school, that was not a normal part of curriculum, so I didn't know what the heck I was doing, and pregnant women actually terrified me. So I thought I was going to break them or like screw something up, or I don't know. So I actually went through the very first cohort of the obstetric physical therapy certification through the women's health section. And I did that almost 15 years ago. So I just fell in love with that population. And then I think from there, it kind of takes a natural progression. You know, you can do pregnancy and postpartum, but you can't do it well without the pelvic health components.
Yeah.
And so I just kept on trucking.
Nice.
Yeah, and then I think on my end, I haven't been a physical therapist quite as long as Meghan, but I have always been an athlete, and I always thought it was really interesting to me to see athletes, especially in, kind of intense settings like CrossFit, where they have no problem squatting hundreds of pounds, but you ask them to do a box jump without a bathroom break right before, and the whole world is ending. And I thought, this is kind of just a need that really needs to be addressed, that people just don't know can be addressed, or that just isn't being addressed.
Yeah, that's a great point. I feel like people it's gaining awareness. What's the pelvic floor? What are these other symptoms you have that are related? But yeah, there's definitely a lot of work still to be done as far as people understanding how it all works together and what their resources are. Great. Well, thank you both for sharing that. Can y'all tell us a little bit about what a typical day looks like at y'all's practice?
We were actually kind of giggling earlier about this question because, and then I think we need to film what a day in our practice looks like too. So we have kind of a hybrid practice in that we see both pelvic health, ortho, and sports clients, but then we also run fitness classes. So our first class is at 5:30 in the morning. So our day usually starts with one of us rolling out of bed and getting copious amounts of coffee and sleepily opening the office to coach our 5:30 class, and then more coffee. Lots more coffee, which is, I know, bad for pelvic floor therapists to admit to drinking as much coffee as we do, but we do. And I'm not giving it up yet. And then we both are athletes ourselves, and so we'll typically train in the morning together, and then we're just kind of seeing, or depending on how our day is, we might train, see clients, finish our training later, meet with other providers, coach some more classes. So we're just right now we're kind of all over the place. But I think we both agree it's the best 16-hour day job we've ever had because
Yeah, that's great. I can definitely relate to the wearing the different hats and like switching gears through different things all day long. And I think you have to love it in order to be able to do that over and over, for sure. So thanks for sharing that. I can understand why you would giggle when you're reading it and then start to talk about explaining it to someone. And I do think a video would be great.
Yeah, I think so. Especially we have discovered this week that Leah says that she drinks 2 cups of coffee.
It's 2 cups of coffee.
Those cups are 20 ounces each. Leah drinks 40 ounces of coffee a day.
I drink 2 cups of coffee a day.
It's just 2 cups. The cup part's relative.
Yeah.
Right. Now I have my large coffee cup here, and I'm confident that this is not 8 ounces. So I probably do the same thing, but very rarely do I get to give Leah a hard time. So sorry.
She's picking that one.
That's all right.
How would y'all explain the importance of pelvic health to somebody that's new to this and may have never heard of it before?
Leah, this is you. You do this really well.
All right. Yeah. So I think one thing people don't really realize is that our pelvic floor is part of our core. So our core, right, we have our pelvic floor at the bottom, we've got our diaphragm at the top, we've got our abs in front, and we've got our back muscles in the back. And if our pelvic floor is not working well, then that can create all sorts of issues in terms of, maybe we're getting back pain, maybe we're not performing well athletically, maybe we are having sorts of, maybe like a hip pain that we can't figure out to deal with. And because our pelvic floor is really the foundation for our core, if our pelvic floor is not functioning well, then our core is not functioning well. And then if our core isn't functioning well, we can't do the rest of the things that we need our body to do well.
Yeah,
Yeah.
that's great.
I would also add that, and I think I look at this as maybe a little bit more woo-woo. The pelvic floor really is the center of the universe. That's where all of us came from. And so if, I've worked with clients that when we really get down to the root of the problem, sometimes their pelvic floor is what's causing the problem, but they're coming in, like Leah said, for back pain or hip pain or even knee pain. And then when we start to do like a deep dive into their history and we discover maybe some not so pleasant parts of their history, it's really interesting to me how much overlap the pelvic floor has in everything else.
Yeah, I think that's such a great point. And one that I think a lot of us don't think of when we're thinking of those other symptoms. Our head doesn't go, oh, maybe my pelvic floor is struggling right now.
Right.
That's such a good one. What do you feel like are some of the top misconceptions that you are kind of continually coming up against in your practice?
Oh, I can soapbox for a minute, can't I?
Perfect.
Okay. Pelvic pain after you have a baby is not normal. Like it's just not. And pelvic floor therapy should be standard of care during pregnancy and postpartum. We are the only industrialized country in the world that does not do that. And it really, really makes me mad. Because I see women who, their OBGYNs, they didn't even look under the hood at 6 weeks. It's really just a follow-up, like, hey, how's everything going? Breastfeeding okay? Or are you, breastfeeding or bottle feeding, whatever it is, because it just, just feed your kid, it doesn't matter. And then, let me ask you a couple stock questions about your mental health that aren't really diving into what's really happening with you as you like care for this human. And that's it. And then we end up seeing women, 6 months or sometimes years after that. And my background over the last 10 years my research has evolved into trauma research as it relates to pelvic floor therapy. And so I ask those hard questions. And I'll start asking questions from clients about, their birth history. And I find out that, mom labored for 8 or 9 hours and nobody was listening to her. And then, they finally gave her some Pitocin to speed things up, and then something was wrong and she ended up either having an instrument assisted or a C-section delivery. That whole experience is super traumatic. And I think aside from pelvic floor therapy needing to be standard of practice, I also think that Western medicine needs to realize that women are pretty damn smart and we know our bodies, and you need to listen to us when we're saying that something's not right. I will step down from my soapbox.
That's you. I think that you cannot say those things enough, because I think too often people's like their stories are discounted or their experiences are, and they kind of just internalize it. It's like, well, this is just the way it is and everybody has it like this. And I think it's so empowering, one, to be heard, like when you get to dive into those and have someone like yourself, like listen and be like, oh my gosh. And you just realize like how connected it all really is. So I think, everything you hit on, I fully support. Yeah, that's a great one. Leah, anything you wanted to touch on?
Yeah, I think the only thing I would add is that, pelvic floor therapy is also more than just laying there without your pants on. There needs to be a whole lot more that goes into your therapy, including, looking at your whole body, actually doing functional things. And, it's not just, okay, you're going to have some stranger invading your privacy while
Right.
you do Kegels. And I think a lot of people don't realize that it's more complicated than that.
Yeah, yeah, it's so much more dynamic than just Kegels and yeah, just an internal exam. Yeah, I think that's a great one. Thank you. Can you share a success story where pelvic floor physical therapy has made a significant difference for somebody?
Oh, we just had one. We just had actually a great one. So we had a client who had recently experienced a lot of weight loss. She had bariatric surgery last summer, and I think is up to I think she's almost hit 100-pound weight loss. She's darn close, and she's doing great. And that surgery kind of empowered her to start taking care of other things in her life. She is a mom of 4, and the youngest of 4, I think, is 13 or 14. And she had been wearing a pessary since her youngest was a baby, and was still having both urinary and fecal incontinence. It had progressed to even coital incontinence, which I've only seen a few clients with that in my career. And just a lot of embarrassment for her. She couldn't exercise. She was afraid to go exercise because she knew she was going to wet her pants, even with pessary. And so she came to see us. And I have to say, full disclosure, I've known her. She's a friend of mine, so I've known her for quite a while. She also is a pelvic floor therapist. And so she kind of knew some of what to do, but needed that like extra push. And we saw her for 6 sessions. And like Leah said, pelvic floor therapy is a whole lot more than laying on a table with pants off. We use biofeedback in our clinic. And so once we did our internal and external exam with her, identified kind of where her deficits were in her whole body, because it wasn't just pelvic floor function, and then got her hooked up to biofeedback. She was able to see on biofeedback how strong I can contract or how it's hard for me to relax. After a period of time, I can't contract with as much effort. And that was really, I think, what kind of tipped the scales for me in figuring out that her issue was some strength, but mostly endurance. And so she would have episodes more towards the end of the day rather than first thing in the morning. And she came in on her 5th visit, and she had not worn her pessary for 2 weeks, and she had not had any episodes of incontinence.
Wow.
And was like, can you give me an exercise program now? And I said, I would love nothing more than to do that for you. So
Amazing.
yeah, like that was just, we were both in the treatment room crying. I mean, I've known her for 10 years. So it's, I've kind of heard a lot of her story over over that time frame, but it was just such a testament to how powerful getting patients up off the table and having the patient take an active role in their care. I couldn't believe we got there in 5 visits. That was amazing.
Yeah, that's incredible.
Yeah.
Well, and what I don't know, what a shift to go from you can't do any of the, movements, exercises, things like that, to like, hey, I'm ready, give me the plan and let's go, and feeling confident. I mean, that's what a huge shift. And that's, I don't know, it's so empowering for so many reasons, mentally, physically, in your day-to-day. That's such a good story. Thank you for sharing that.
Yeah, absolutely.
Great. Okay, next one. So I know, of course, pelvic health, and any sort of, care plan is like tailored to the individual, but are there any kind of tips that you have on a more general level for folks if you're talking about, daily things or just kind of ongoing, consistent things you can do to maintain good pelvic health?
Leah,
Yeah,
you want to take that one?
sure. I mean, I think there are some sort of basic ones, sort of like, not peeing just in case. So, our brain and our bladder are really trainable, kind of just like a puppy. And if you're constantly, thinking, let me just go to the bathroom just in case, then that can be something that over time is going to make your bladder more sensitive to having anything in it. So then that's going to feed into, always feeling like you have to go to the bathroom, which can kind of avalanche into other issues. So just, generally speaking, trying not to go to the bathroom unless you do truly have to go is going to be a big one. And then another one that I know I struggle with because I am a huge germphobe is not hovering on toilet seats.
Oh,
Like, I
yeah.
think if I had to probably listen to Meghan tell me not to do that for at least a year and a half before I would even consider it. And even then, I'm in the bathroom, like constructing this like elaborate toilet paper nest on the seat before I'll be like, okay, like this is acceptable for me to sit on it. But that's just another one in terms of just promoting, emptying your bladder all the way and being in a good position for, just maintaining your overall pelvic floor health. I think those are
Mhm.
kind of the two big areas where I see people struggle with a lot.
Those are great. Yeah. Thanks so much for sharing. And I know I've even seen on social media, like where folks have talked about the like, don't hover over the seat. And some people are just like, I can't not do it. Like, you can't make me. But I've heard how important it is. So I think both of those, a lot of people will be able to relate to. So thanks for sharing
Yeah.
that. Great. Will you talk to us a little bit about how working with someone like yourself can be important through different stages of life? I know, a lot of people, it's during pregnancy or postpartum that you're first kind of keyed into pelvic floor physical therapy. But outside of that experience, and you can talk a little bit about that as well, but why is it important for folks to know who you are, when to come see you as your body changes over time?
So I'm so happy about this question because when we decided to open this practice and do this business, we sat down, there's a coffee shop, like for Leah's 40 ounces of coffee. There's a coffee shop right around the corner from our office. And we frequently have our business meetings there. And we sat down one day and we were trying to figure out at the very, very beginning, like what do we as a business stand for? And so our, I guess, slogan, if you will, is empowering you to thrive in all aspects of life. And so our dream is that when somebody comes into our practice, either from the fitness side or from the physical therapy side, we're a little like the mob. We're not going to kill you and dump your body if you want to leave, but we're going to make it really hard for you to leave because we want to do exactly what you just said. Like, we want to help you achieve like whatever thriving looks like to you. And so once you come in, let's say you come in for pelvic floor therapy, we're going to look at everything else. And we've had clients, we have one right now who I think initially came into us for pelvic floor, and she's just very stiff. She doesn't have a lot of really great mobility. And so that limits her from being able to exercise. And like, she actually can't lie down flat. She sleeps in a recliner, which is like, that to me is just a horrible way to sleep.
Yeah.
So she's kind of our ideal client because we want to do everything we can to help you in every aspect of your life. So you might come in that way, but we're going to attack the whole thing, and give you, I think, usable tips and tricks that are easy and not like, oh, I need to go do my PT exercises, because like, for real, who does that? I'm a PT and I've been a patient and I don't do that. So full disclosure.
Yeah, I feel like, thinking about that too, I like your response there, because I also think it's helpful to know that, like, if I come in for this thing, as my body changes, as I get older, as these other things change, like, you all are still such a good resource to come back to over and over again, because with how everything's, comes back to your pelvic floor, and that can impact so many things that you're not thinking about. Yeah, I think I was so thankful when I first learned about pelvic floor physical therapy, and have been able to come back to it over and over again, because it has been a resource I've turned to over the years, and plan on being able to, continue to pursue that in the future. So I think that's a great point that we can, take away from this, is it's not just pregnancy or postpartum. It's something that, over your entire life, regardless of kind of what the things you're dealing with, it can be a great place to start.
Well, and one of the things that we also have tried to do in terms of networking, like in our community, we network with nurse practitioners and functional medicine and naturopathic physicians, because I frequently, especially, so I'll be 44 this year, so I'm like in the thick of perimenopause, yay. And experiencing that, I realized that Western medicine is not going to give me anything to help me feel better.
Yeah.
And so finding people who, just like when you're pregnant and postpartum, you know, finding people who will believe you, honestly, like these are the symptoms I really have. And so we have worked really hard to educate ourselves as much as we can and network with people in our community so that we have a good place that we can refer our clients to, you know, as they're going through that stage of life, and kind of help them through those things. Because my husband gives me a hard time. He's like, well, men change too. And I'm like, do you really though? Like, you're still wearing the same pants you wore when we met 13 years ago. I don't even know where those pants are. And I've like aged and had a baby and a C-section, and my hormones don't know what end is up. So
Right.
yeah, like we want to help navigate that whole thing for our
Oh man, I can relate to that, to the different clothing sizes over time for sure. Oh my goodness. So kind of speaking to one thing you were just talking about, you know, I know things, you know, I feel like in this space, you know, there's and I think especially with you being in like the research field that you're in as well, like it's interesting to see like with it being kind of under researched, under talked about, you know, there's so much room to improve. What are some of the things that you all key into, like kind of over the course of the year, to tap into like latest research or trends and just kind of stay current as the industry and the knowledge base continues to progress?
I definitely think because I'm still in academics, I have like that kind of forces me towards that, which therefore I come to Leah and I'm like, ooh, look at this that I just saw. I think PT school also, if they did a good job, I think PT school should condition you as a provider to want to commit to lifelong learning and look at those things up. That was something that to me was very important in our business, and our business coach was like, yeah, nobody cares and nobody knows what evidence-based practice means, only you. It's like, okay, I'll just concede that. But I do think we also really want to help empower our clients with education. And so I am that therapist who, if you want it, I'll send you the article. You know, or I can write a little blurb and tell you what this article, you know, talked about, because I think there is a lot of potential out there for research. One of the things in the research realm that I think we run into is that pregnancy is a protected class of individuals to research. IRBs don't really like you doing research on pregnant women.
Right.
So that's challenging. I think it's the University of Edinburgh in Canada. Margie Davenport leads a phenomenal research lab there. So most of the pregnancy postpartum pelvic floor as it relates to exercise is coming out of her lab. And the stuff that they come up with is just, it's amazing. Like, she's so creative. I love,
Cool.
I have a Google Scholar alert for her name.
Nice, when she puts stuff out.
Yeah, she puts stuff out. I'm like, oh, what did Margie do this week? But I do think that because it's become slightly more mainstream, I think we are starting to see more and more research. But just like anything, you know, one thing, what we might find out this year, in 2 or 3 years might be obsolete.
Right. Yeah, it's changing quickly. And I think we're learning a lot more, so that, yeah, can cause that to happen. Great. Another question I wanted to ask you all about is, you know, I know a lot of times when people are, you know, coming to you for help, it can feel very isolating and like it's all on their shoulders to do this. Do you have any advice for if they have significant others or partners in their life, or even friends and family members? Like, how can they, like, I don't know, feel supported by those other people while they're, you know, navigating some of these conditions and, you know, kind of that road to improvement that they may be on?
I would say creating an environment where like it's okay to talk about these things. Like Megan and I were talking about this a little bit yesterday. Like, there is a lot of shame people have often when they're injured. And, you know, pelvic floor condition isn't necessarily an injury per se, but it's still, you know, a body part that's not working the way that you want it to.
Right.
But it's also embarrassing because people just don't really like talking about, what's going on down there. And so I think just creating a space where, it's not taboo to talk about your bodily functions. It's okay to, maybe talk about body parts that aren't normally talked about, and, just creating, an open environment. And I think, a lot of people, if they haven't been like pregnant or had children, they have pelvic floor issues. I think there's kind of an extra emotion side up because they feel like it shouldn't be happening to them. So I think just, being open-minded and trying to educate yourself as a partner in terms of, what even is the pelvic floor and why do people have pelvic floor issues, and just trying to be more just kind of aware and open to what's going on.
Yeah, I could not agree more. I think I will always tell women, if your partners are comfortable, bring them with you, because I think that helps. There's also a book that I refer clients to if they like to read or listen to audiobooks. There's a book called Come As You Are by Leah Mycofsky. And she does a really good job of unpacking sexual health as it pertains to pelvic floor therapy. And especially, I think, in the postpartum and even like early childhood kind of years, moms are tired and touched out. So I love you, partner. Also get off me. But then as we age, we've got hormonal changes, and we might not have like the vaginal lubrication and things that we need to for a healthy sexual activity, but it doesn't mean that we're not interested. And she calls that like sexual incongruence, where like my body wants to, but my brain wants to, but my body's like not cooperating. And just kind of dispelling rumors or myths that, your sex life is over because you become a parent or because you're in perimenopause or you're in menopause, and just having those free conversations. And like Leah said, really unpacking the shame that's surrounding it, because when you talk about shame with somebody that you feel connected to, that shame goes away. And then it just becomes something that you can work through together. So I think I wish we saw more of that.
Yeah, I agree. I think those are both great. Thank you so much. I'll work on wrapping us up. Would you each share like what you feel like is some of the most rewarding aspects of your work?
Leah, I'll let you go first. I'm going to think a little bit.
All right.
I'm going to totally put you on the spot. I'm sorry.
That's fine. I think it's really rewarding, especially because there isn't the awareness of pelvic floor or pelvic floor physical therapy that there should be, to get people feeling back to their old selves again when they thought they never could. Like, I love when my patients come in and they're like, I never even thought about my bladder. I haven't thought about it since I last saw you. Like, I just feel like myself again. I think just helping people get back to feeling like themselves is probably the most rewarding aspect.
Yeah, I think I would probably say the same is something similar. I really like, my love is pregnancy and postpartum. So most rewarding is probably the babies, because I do love it when babies come in and I can get some snuggle time while I'm working with their moms. Rather than, and I think this is pretty specific to that, to the postpartum population, rather than feeling like their old selves again, I really like helping them navigate the new person that they're becoming as a mother. Because there is the person that you were before you became a wife and a mom, and all of that stuff. And you don't want to lose that identity, but also your identity is going to change as you become a mom. And that particular process was really challenging for me personally. And my son is 6, and so I'm still in that kind of evolution. So I derive a lot of joy and gratitude and fulfillment out of kind of experiencing that with my postpartum moms and learning together how to navigate that new space.
Thank you so much both for sharing. And thank you so much for having this discussion with us today. Is there anything else, any other parting words you'd like to leave us with before we wrap up?
I don't think so. Thank you so much for having us.
Yeah, thanks for having us.
I kind of, like, you asked us a lot of questions about you, but I just want to say I really I am really inspired by your story and why you created what you created, because you were like, okay, there's nothing that I like, so I'm going to my own. And I think that's awesome.
Thank you. I appreciate that. Thank you very much. All right. Well, we'll go ahead and wrap up and we'll talk to y'all later. Thank you.